Hi, I'm Emma, also known as the Naked Doula, and this is the Fearless Birth podcast, taking you from fear to fears through self-trust, education, and body awareness. This episode is sponsored by the amazing Wave Comb for Birth, the best tool for managing those sensations, and Her9, a wonderful natural supplement for pregnancy, birth, and postpartum. Today, I am joined by the amazing Sarah Fitzsimmons, an independent midwife and home birth and out of guidelines expert. Sarah, thank you so much for joining me today.
Thank you for having me, Emma. You okay?
Yes, I am really well. I'm really excited. And I really want to just dive in. What does it mean about out of guidelines? Like, what does that actually mean?
Oh, well, we are in a double-edged sword situation in the UK in that we have a really set of guidelines that are created by NICE, National Institute of Clinical Excellence, and they sort of set about the gold standard protocols, if you like, for maternity care.
Okay.
What everybody should be offered, who should be offered it, processes to standardise the quality care across the country. And what happens is that they are within certain guidelines that you might be introduced to, depending on your individual health circumstances. You might be classed as low risk, and that, birthing unicorn that
Right.
barely anybody fits into. Or you might be introduced to different guidelines based on your individual health circumstances. And when you want to sort of cross guidelines, that's what we call out of guideline care.
Right. Because it's so generalized, isn't it? It's like literally saying, here's a box, like everyone has to fit into the box, like, or else. Like, that's what it feels like.
It can do for a lot of people, especially if they've just no idea how to navigate that system. And there are lots of processes in place and support networks in place, but if you don't even know where they are and how to navigate it and how to move from one pigeonhole or out of the pigeonhole process it completely, it can be really quite daunting as to how to figure out to access the care that you want that feels right and safe for you, even though it doesn't fit into that pre-populated pigeonhole.
And it's so interesting, isn't it? Because like you mentioned, it really does cross over like so much. And actually to be classed in that sort of low risk, you literally have to be sailing through pregnancy with just like, la, 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 like, just to the end. When actually, that's not really the case for like a lot of people. And they may, be some certain circumstances, or they put in the, whole thing about BMI or age or things like that. And it actually takes into no consideration of anything else, like their actual health and their individual circumstances.
What has to happen in order for mainstream maternity services to deal with such big numbers of births? It's like 500,000 babies are welcomed in the UK every year. They start that pathway by figuring out which pigeonhole we can slot you into. And then when you go through the other side and reviewed, what should then happen is that there's like an individual holistic assessment as to, you might be classed as having a higher BMI, but actually it's because you're a professional bodybuilder.
Right.
You can
Literally
lift ridiculous amounts of weight above your head. You've got massive muscle strength and muscle mass. Etc. You are extremely fit and healthy and with an exceptional nutritional status. But what isn't happening, unfortunately, due to the demands on the service very often, or the processes aren't there automatically, is that full assessment, that 360 review doesn't happen after that. So you're left in that pigeonhole guideline. So your BMI is high regardless of your health status. So we're going to do X, Y, Z, and these are restrictions on your care.
But even if you're not a bodybuilder, even if you're just like a big girl, but you're absolutely fine. Like, I mean, the whole like shit about, you can't get in a pool because you can't fucking lift you out kind of shit. Like, what is that about?
So
fucking hell. Like, what?
A lot of these guidelines are put in place because we're just not ethical to do the research behind it to find the actual data. And it's data that is the key to figuring out, are you within that right guideline? Does it apply to you? But often that data doesn't exist. So we're completely reliant on a group of people sat round a table, sort of going, well, this sounds like it'd be a good idea. We'll put a cut off here. We know in depth that the BMI model doesn't work. For example, it's very...
It makes no fucking sense.
It makes no sense. It has nothing to back it up as being a reliable kind of model to work around, but we're completely dependent on it because it's easy.
Right.
And so they build these things around it. So they'll say your BMI is 35, 40, whatever that might be for that pool. So we don't want you to get in it. But if you're 2 foot taller and you weigh exactly the same, your BMI is lower, so you can get in it. But actually, those two people weigh the same, and we're going to, they're going to be the same to lift them out the pool.
I've literally just had like a mind-blowing moment because I've never actually thought of it like that. That is insane.
Yeah.
That is just absolutely insane. So obviously you're an independent midwife, you specialise in home birth and out of guidelines. What was the process, or the sort of thinking for you that took you from the NHS to being an independent midwife? Was it this generalised sort of way of thinking?
So for my own births, I actually did a lot of this journey myself. So when I had my first baby, she was a breech baby, and I knew that to have the breech birth that I wanted and to have it at home was going to be so far from any guideline, I could barely see it on the horizon.
Right.
And it was my first baby, but...
Was you already a midwife?
Already a midwife, very experienced and very exposed to physiological birth, and I had every confidence in my body to be able to do that. And if it was going to do that, it was going to do that in the ideal environment from a primal point of view, which is that nesting space.
Yes.
So I navigated that system with an independent midwife at the time, and due to the way she'd kind of got herself in a higgledy-piggledy, long story short, she did need to come by cesarean birth, which was all on my power. I made that decision. It was a great experience. Loved that really positive experience. It was brilliant. And the next time we came around having a baby, again, wanted to have a HBAC at home.
Yeah.
So again, I was journeying that system. And even being an extremely experienced HBAC midwife that has supported a lot of HBACs at home, the way I felt and was treated and spoken to by the obstetric model just blew my brain, that if I was being spoken to this way, them knowing full well what I did and what I do, that what most women going through that journey going to experience.
Oh my God.
So for that birth went beautifully. It went really well. Izzy was born at home. And then I went on to have 2 more babies. So that is 4 in case you count it.
Wow.
So the next 2, I opted out of obstetric care. I'm not saying that's right for everyone. That's just what worked for me.
Right.
They'd already told me with my second pregnancy whatever they wanted to tell me. And I was very capable of making informed choice. I'd already made that choice. And I didn't feel I needed that support. But I don't know, it would have been all that much harder if I didn't have a midwife that was able to step outside of hospital policies and the sort of restrictions upon her practice from the hospital. And also, if I didn't have someone who firmly believed and understood physiological birth.
Right.
So when I went back to work after my 4th baby, I made sure that I was really exposed to I was already a birth centre team midwife, core midwife. I went to do agency work in loads of other birth centres to see what's going on in other places, and then went on to become a birth centre manager. And what I realised moving up through the process, becoming a sister, sort of leading other midwives, that was brilliant and that was easy, and loads of those midwives were really open to the support and learning more about physiological birth, but the system wouldn't support it. So
what a shame.
Yeah.
What a shame. You was in this position where literally you could pass on this wisdom, pass on, this support, and, everyone could be leading with the same holistic views, you know, as yourself and individualized care, and yet they were not able to. Isn't that like, it's so sad.
It was, and I'm not saying that every trust is like that. It's not fair to say that. But on the whole, it was due to resources, and resources is an issue everywhere.
Right.
So the new insurance came out around June 2022, and one of my team members, who was like soaking up everything that we were doing and just absolutely adored it, Jenny, she came with me, and we made the decision to leave the system and be able to influence and support that change for individual families from the outside rather than the inside. And we've been doing that since.
Wow. I mean, and you are a team. You are a team. So obviously, being an independent midwife now out of the system, but obviously still within guidelines, but just understanding the guidelines and being able to influence and to manage individual circumstances, right? So do you support purely home birth now, or do you support like all different types of birth?
Oh, like all different kinds of birth. One of the brilliant things I think that my own cesarean birth taught me was that just making that decision and holding that power was so incredible. And it gave me even more insight into families that choose all kinds of different births.
Yes.
So certainly what I've made the decision to do is utilize that agency work to build up a relationship with one particular trust. We have an honorary contract, so I can actually support clients in that hospital, providing clinical care in that hospital. And what I find is a lot of trusts that we work with are so grateful that we're taking work off them, and taking some of the pressure away from them.
Right.
Just the other day, I went to a trust, and the community manager gave me a bin bag of equipment to take out, like, take all these blood bottles, take all these blood forms. We need you in this area. Our home
Oh
birth
my
team is really
goodness.
struggling. We're going to tell the women about you, like, take 10 packs of booking stuff because we want to get these women booked in. And so there is a lot of support from the midwifery services because they get it. They get it.
Do you know what? Honestly, I don't know if anyone's told you this before, but like just how wonderfully adaptable to be able to come out of a system, but then flexibly be able to like work with and around and just make that work when actually so many people become so rigid with this, like, and make it very like black and white. But actually, when you can build and when you can have those conversations and when you can create relationships which are much more beneficial for you as a midwife, as a provider, and for the women giving birth.
Yeah, and it's safer for
That's
women and
fantastic.
babies.
Right.
So what those mainstream services do exceptionally well is supporting surgical birth, and that's what I can't do. So what I do exceptionally well is physiological birth and early detection and recognition of when things are, the rare occasions that things aren't going the way we would expect.
Yeah.
And what they do really, really well is supporting those surgical births, whatever route that might take. So it's about pulling the cream from every element and every area of expertise, and then providing that to women and families to give them the very, very best that they deserve.
100%. And I mean, I think that, for example, like, your first birth story, and, particularly like mine with George, like I was like all set for, a home birth, and it didn't work for like whatever the reasons are, which is still like we're still really looking into to understand. But I needed that support from the system, and I had, maternal lead. I pulled him out of my belly, first one at that hospital, and it was incredible, and it was so needed. But my case and my situation is very rare. And let's like sort of delve into that, and sort of go into that home birth sort of environment, which is actually should be very normal and normalized for women, because birth works, doesn't it? Birth works, and it works best when it is undisturbed, when you're feeling safe, when you're feeling happy, when you're feeling supported. And most people find this kind of feeling and emotion and, at home.
Yeah, it's a very primal process, as whether people feel comfortable with it or not. It is a very, very primal process. It relies on a primal hormonal process, and we are mammals, and we are designed to birth in our nest. We create a nest like so many other mammals do. We call it home, and the physiological process of birth blossoms and the hormones flow most readily for most people. I know not everybody has a safe home environment, and that's not where birth will work best for them, and that's absolutely fine.
Absolutely.
And again, hats off to mainstream maternity services, because that is a safe place for a lot of people, and that is cool, because we don't know what journey they've been on before they even come to this pregnancy.
Right.
But for most people, home is the default place of birth for their primal receptive and hormonal processes. It's just that they don't know about this because of culturally, it's not the norm.
It's not, and we're programmed and conditioned, and we are afraid and we're scared, and it's just now it's just so like abnormal. I mean, I do feel like people are more open eyes now. I think people are more like, looking into different options, but it just doesn't feel like a normal process. It feels scary. Like, why would you do that? People still ask, don't they? Why would you have a home birth? Like, you need to be saved literally by, doing X, Y, and Z. You need to be in a hospital because, but actually it's not the case.
We've come to this point in our culture where we have had centralized maternity care, where and it is more convenient. If from a logistical point of view, it's much easier to bring everybody into one place, have the equipment all together where you can share it, and resources are pooled. And that does make sense from that point of view. And we've moved to like this view that birth is just a mechanical process.
Yeah.
The uterus is a muscle that just pumps, and then the gate opens of your cervix and a baby is expelled.
Or fucking pulled out.
Pulled out.
Let's just throw that in there.
And it's just something that can be measured and assessed. But actually, and the last time we were exposed to home birth as the norm, we didn't know how to resuscitate babies. We didn't have medication to stop excessive bleeding. We didn't have the underlying knowledge that we do now, and the skills and equipment that we do now. So we've become culturally, brainwashed that is the safest place for it to be, is in the hospital.
But isn't that wild, right? Because if we go back in time to when home birth was like a standard thing, and, induction wasn't needed, cesarean rates were extremely, extremely low. And obviously, they would have been, we understand there would have been fatalities, which now could be, complete, they just wouldn't happen in this day and age.
Yeah.
But back then, it was pretty much like, this is the process, and it was still safe, even though you didn't know how to, or they didn't know how to manage those certain things. Because, otherwise we wouldn't still be reproducing, and we still wouldn't have millions and millions of, people in the world. But yet now, home birth is so much safer because you understand, and because we understand how to deal with these situations. Yet we've got a massive increase in inductions and a massive, absolutely ridiculous increase in abdominal birth, in cesarean sections.
The situation we're in now is that we're blessed with so much data looking at home birth versus hospital birth on a par, comparing apples for apples.
Right.
So with all the underlying skills, with combining traditional midwifery and modern obstetric knowledge, if you like, we can now compare home birth to hospital birth. And what we can see from that data is three major things.
I love this. Come on, give me the juice.
We can see that if you call long-term complications and deaths, if you look at the rates of those as being safe, if that's what the data calls safe,
yes,
then you are just as safe having your baby at home as you are in the hospital. So you know more any chance of having of you dying, baby dying, whether you're at home or hospital, the chance is the same overall, if you like. Okay, they're just as safe as each other. The second thing that we know is whether it's your first or second baby, it's just as safe to have your baby at home, because that's a really big misconception.
it is.
Don't have your first baby at home.
Right.
Let's wait and see if you can have a baby
Oh
first.
my God. Let's see if your body can work. Let's see if you're capable.
Yeah.
Fuck off.
Rather than actually, maybe these first labours, these might be the ones that actually need that environment more.
Oh, yes.
But anyway, the data tells us it's
yes.
just as safe,
Yeah.
both whether it's your first or second baby.
Yeah.
And the third thing it shows us, which the data doesn't refer to as safety, I personally would, I bet you would,
Yeah.
is that the incidence of any like major complications, things like bleeding, babies needing additional support, whatever it might be, any kind of like major incidents, all those things are less likely to happen at home.
Well, of course they are, because it's fucking undisturbed, more undisturbed than physiological. Do you understand oxytocin? Like, literally, sometimes I feel like screaming it to people, like, do you know what oxytocin is? You know?
Yeah.
Fascinating. One other thing I want to add about that, I've got a fourth.
Go.
As a high-risk birther, you are safer to have midwife-led care than obstetric care.
And the data's starting to show us that with home birth as well. So it's the issue is we haven't got it all there yet, but what it's starting to show is that you're more likely to have a vaginal birth if you have a VBAC at home. You're more likely that if you have a raised BMI, bunny quotes,
yes,
and you've had a baby before, not only is it just as safe to have your baby at home, it's probably safer than being in the hospital. And so these bits of data are starting to trickle through, but it's getting that data and getting people willing to gather and process that data as well.
Right, because when we're looking at, you know, data as a whole, like, it just seems so mismatched. When when we have, like, obviously we, like, looking at this information as it's coming out, we're looking at this new research coming out and data coming out all the time for that individualized care. But then in the hospitals, it's literally like they're still looking at something from 100 years ago or something. Like, literally, like, honestly, I can remember asking for some evidence to back up, like, some things that were said to me, and what was sent to me, I was like, what? Literally, where has this even come from? You know, like, what does this, makes absolutely no sense.
It's when you've got a big institution like a trust,
Yeah,
it takes time for new practice and new information to trickle through. So I was doing an agency shift maybe, I don't know, a couple of months ago, and we were talking about delay in second stage.
Stop. Honestly, do you know, this has literally come up in literally every single conversation.
And or maybe delay in first stage, I can't remember. Delay.
Yeah.
Delay, bunny quotes again.
Time.
We get a lot of exercise in my fingers with the bunny quotes.
Yeah.
And the NICE guidelines had been updated maybe a year ago, maybe 6 months ago.
Yeah.
And so I was following those processes, or at least advising the woman on those processes.
Right.
And when I relayed this to the coordinator that was on the delivery suite, I was on the birth centre, she was like, oh, you can't do that. That's not in our guideline. I'm like, it's not in your guideline, but it's in the national guidelines. What? And she didn't know. She had to look it up. And then what will happen then is there'll be a cascade and it'll get fed back, and then it takes time to review their current guidelines, to implement new changes, to get it reviewed, to get it peer assessed, to then get it in place, to train new midwives, to cascade the information across. So then it's probably going to take another 6 months again to get that into practice. So even when those guidelines are updated, it takes time to trickle through. So that's why it's so important. Just check them out yourself. They're all there. They're all available, so that you know the most updated information, because it's not those midwives' fault necessarily on the front line, but they're not getting they're not getting that information about the changes happening.
Yeah,
From
exactly.
their
Well,
point of view.
it's just insane, isn't it? This is why everyone really does need to take ownership for their pregnancy and birth, to understand their body, to connect with their body, and to understand their rights and the guidelines around that. You know, like, how can I work around that? So going back actually into home birth, like, itself, like, so when you have, obviously you support like a lot of families in home birth, absolutely wonderful. And the process of home birth is just gorgeous. Like, you and your rates, your like your data, I mean, you love a bit of data,
Yeah.
is fascinating. It's just absolutely incredible. What is it? Like, what is it about you supporting these home births that makes it so, like, successful? And I think I know, like, I understand, but I want you to talk me through it.
So our looking at our own data, so 95% of our families birth their baby vaginally. So that is a big, big contrast into the, like, for, you know, I think we're around 50 to 55% in mainstream services.
Yeah.
And our clients aren't all low risk, or, you know, birthing unicorns that have nothing interesting about them whatsoever.
Yeah.
Half of them are classed as high risk. Half of them are first time families having babies. They're not all third babies that just kind of
Just
get spat out.
Yeah. Yeah.
And really, most families are coming to us because they've got more complicated individual health circumstances.
Right. Interesting.
But what happens is, because we provide what's known as, like, relationship-based care, so it's official term is continuity of care.
Yes.
So because we're building a relationship with those families, they're getting to know us really well, we're getting to know them really well, we're getting to know their baby really well before they're even here, so that when birth occurs, when labour occurs, we are able to take a much more sort of set back, holistic view of the whole situation, because we're not just watching clinical information.
Yeah.
We're watching her behaviour, her movements,
Yes.
the way she holds her body. We've seen this for months before, and why is this different now? We know what that baby's heart rate has been for months and months before. Why is it different now, maybe?
Yes.
They say, is it like 80%, 90% of language is non-verbal? So she's not using
Yes.
any of her conscious brain to assess our body language and what we're doing. What does that tone of voice mean? She's able to just disappear into that really primal headspace, because she's not on high alert that who's this person and what is their agenda and what are they about? You know, are they just desperate to get me in for whatever reason?
Yeah.
So she's able to just really go into that really primal space in her head and her body. And because we built up that relationship, and it's not that, I'm not saying this is the case for everyone, but for a lot of the families we care for, there's no holding back from, like, whipping all the clothes off or bending over here or shoving that leg up there or whatever.
Yeah.
They don't feel as shy or as exposed. They can just move and be their real pure primal self in their own space.
I mean, isn't it just so beautiful when someone can just allow themselves to just be in that moment during labour and completely trusting of everything and everyone around them? It literally makes me feel, like, emotional, because it's just so precious. And I think that, like yourself, like, it's just, you're so understanding of this whole process of trust and the physiology around that you can just, again, it's adapting, isn't it? Understanding, watching, like, this is exactly the same, like, for me, when I feel like I'm supporting them, obviously not in a midwife capacity, in a doula capacity, like emotional support, but just reading the room, understanding. What a beautiful process. And no wonder the percentage is 95%. And I'm sure those 5% are those people that actually need to be in a situation where they need some help or need some care.
Or they feel that Like for some of those families, actually, it was a conscious decision. Like, this is where my line of safety hits, and I don't want to have an induction, and I don't want. We had a client whose waters had released for 9 days, and that was her boundary. I've hit 9 days, no more.
Yeah.
And she knew exactly what was available to her. She knew exactly what options were open to her, and she chose a cesarean birth. And that is
Yes.
extremely powerful to be
Oh,
able to say, I know what this induction involves. It's not for me.
right. 100%.
Just, yeah, either way, it's really powerful.
Literally, I was exactly the same with my situation, like with George. There was just no, like, that's as far as it goes. Like, I don't want to go into any other process. And that's so powerful. And just owning those decisions and leading with that and being supported in the right way is everything.
It's safety, and what you perceive as safe and what I perceive as safe and what someone else perceives as safe, that line of safety is totally different for everyone. And to meet that line yourself and make a decision stood on it is so powerful, as opposed to someone saying, here is the line, and coercing you into a decision, or forcing you to make a decision there and then. We've recently, I've been aware of a trust locally that is encouraging clients to book patients, their people they care for, a breech elective cesarean from 32 weeks, because the baby was breached at 32 weeks. Now, what is that about?
I'm sorry, what?
What is that about? And I thought that was maybe a one-off, but then there've been other things that have come out, because I work quite closely with the local NCT group, and those decisions are being forced earlier and earlier because it suits the demands on the service are such, they're getting so full that they need those decisions making earlier. So to be able to have freedom and space to be able to meet that line of safety in your own time, at your own terms, is so important to your mental health as well afterwards.
100%. And, talking about trust and talking about relationships and connections, I think that's what really differentiates, doesn't it? Like with chronic system, the NHS, midwife capacity compared to an independent midwife, because it is that continuity of care. It's that trusting relationship. It's, is it any surprise when you're in a room and women are walking in, people are walking in. Sorry, I say women, like some midwives may not be women, they may be men, but they coming in and out and you don't have any relationship with them. You may have never met them before in your life. You don't know who they are. And actually, as humans, like, we need connection. Like, it's the main thing for us to survive. That is really sort of what sets you apart, isn't it? That trust, that relationship, and people just to be able to let go.
The other interesting thing that data brought in was that even if you plan for a home birth but don't have it, because you are more likely to have that continuity of care, because you're more likely to build up that relationship with a midwife, because often in a lot of trusts now, the only continuity groups that or continuity teams that remain are within the home birth team. So you're more likely to get that. And also you've got midwives that work on that team that get it. And they want that continuity. They want that relationship with women. Almost all midwives want that relationship with the families they care for. And if you access that pathway of care, whether you are actually intending to have a home birth or not, or whether you are able to have a home birth or not, maybe the service isn't available on the day. But even just planning for it massively improves your chance of outcomes for you and baby.
This is great. And I think this is really good for people who are in a situation maybe where they, let's say, for example, like, and I know there's all different options and availabilities when it comes to independent midwives, but say that cost is like a real big thing. And they absolutely just cannot do independent and they need to go through the system. So what can they do, just leading on from that piece of information, what can they do leading up to their birth to improve the outcomes? Literally just plan for a home birth.
That's one of the most simplest things that you can do if you don't fall within guidelines, which probably the majority of people don't now. culturally, we're, as a society, we're wanting to like establish our careers and have our babies later and things like that. And we're, loads of things that sort of make us fall outside those guidelines.
Yeah.
If you are wanting to hack the system that is available to you, find the best, pull the cream out of it, book with the home birth team and tell them that you want to have a home birth. And if you're outside of guidelines, then you can also access support from the consultant midwife. If every trust should have a consultant midwife, if they don't, they'll have somebody sort of covering that position. And what they'll do is they basically act like an independent midwife. So they're supposed to stand independently from the policies and guidelines of the hospital, give you that time to review your individual health circumstances, to go through what your safety boundaries are.
Yes.
And how they can provide care that works around you.
100%. I literally did this for George's pregnancy because obviously I just fell straight into the whole consultant led because it was going to be a VBAC. And I was like, obviously the same, like I'm going to go through home birth. So I had to go through this whole process, but it was great. And I got to sit down and I had a whole conversation about like a birth plan and, everything was put into place because that's what I chose to do. And it was out of guidelines. So, and actually it's interesting you say that because I haven't thought about this until now, is that maybe like that's why when I actually I know I had good conversations along the way, but maybe that's why when I actually got to the hospital, everything seemed like there was no challenge. There was no challenge.
Yeah, and that's how it should be, really should be. So the idea is that within all care, the key is ensuring informed consent.
Yes.
Because we don't want anyone to be coerced. We don't want anyone to make fear-based decisions.
Yeah.
We don't want anybody to make a decision because Joe in the corner shop said that was a good idea.
Yeah.
And that's all they know about it. So we want them to make decisions based on as much information, data, evidence as we possibly can.
Yeah.
And if we can do that antenatally, then there shouldn't be any challenge to it in labour.
Literally. Okay, let's dive deep into, or literally was just thinking about like my experience like at home and how it like felt to me. And it made me think about the statistics around like things like pain relief and, intervention and stuff like that. When we're at home, it just feels different.
Yeah.
Right?
Yeah. So we have something called the pain, fear, tension cycle.
Yes.
And if we can avoid tensing, like mentally as well as physically, then your body relaxes more. You aren't going to release as much adrenaline. So your body will not sort of fight the sensations of labour as much. So that everything becomes less uncomfortable. When you are relaxed, your body pumps out endorphins to support the sensations of labour.
Right.
And they reckon endorphins at full flow is the equivalent to like an IV dose of morphine.
Literally. I love this so much. Like they are just the best. Like I like to call them the SAS. Like they just fly in, bind to the end of the nerve receptors, and they're just like, whoa, like we're here. And it just takes you into like I can like manage this and deal with this. And at home, if that's the most comfortable, safest place for you, you literally can get fucking high.
And women look high. They look dopey. They look like, do you know, if you've ever been around someone who's a bit drunk and you ask them a question and it's almost like the question has to circle the room before they answer it. That's what they look like.
Yes.
And so we want as much endorphins as possible. You've also got so much more freedom of movement, which is going to make things more comfortable. It's not so much that you are forced to stay in a certain position in hospital. It's just much more likely as you fall into this subconscious patient role.
Yeah, 100%. It's easy to just get on the bed.
Yeah. And the room is geared up to encourage you into the most unnatural positions, etc. Right. So at home, you're much more likely to require pharmaceutical-based pain relief and epidurals, things like that. You still have those options. You always have those options because you can go in. What you can't do if you plan a hospital birth is go home. You're not a prisoner. I mean, you can go home.
You can go home,
but to get the midwives to come to you, etc., is going to be very difficult. Yeah.
So within that home environment, so the benefits are just insane. You're going to be feeling like a lot less pain. You're going to have access to, a pool. Some people don't even use a pool. That's another thing, isn't it? Because people just put the two and two together, but that's not necessary. You've got the freedom of movement. You've got the ability to just go wherever you want in your house.
Yeah.
Eat, drink,
Your
have a
own
party.
toilet. Everybody
go to the toilet. Literally.
The best snacks.
Have an orgasm if you want.
Yeah. Feel free. Yeah.
Feel like, just comfortable.
Yeah.
There's just, there is so much. And actually, when you pair that with the data, regarding the safety of home birth, it's almost like, why would you not?
Yeah. But we're not given that information.
No.
Routinely.
No.
That's the unfortunate thing. And when you're at home, things like, again, these are all really evidence-based support methods that are dead simple. So like aromatherapy, you can chug out as much aromatherapy around your and that massively reduces anxiety, improves birth experience, reduces fear, tension, reduces length of labour.
Yes.
So you can chug out a load of aromatherapy wherever you want around your house, but obviously in the hospital they've got to consider who's in the next room. Are you on a ward? Is it going to affect other people who might not be term? Lots of other things to think about.
Yeah, exactly.
You can use a TENS machine.
Yes.
You can.
Gas and air is also an option, right?
You've got loads of gas and air. Yeah, we can.
You've got the wave comb.
We've got the wave. Do you know this wave comb? We use it all the time. I didn't think, like most, probably a lot of people think, how can a comb do anything? We had a client, first baby, she was just in the pool, 2 combs, nothing else, and she birthed that baby like an absolute rock star. And you're like, there is something in this. And now we encourage everyone to even take them on agency shifts. I like whip it out of my pocket. I'm like, have a little squeeze.
Yeah, literally. Like, you don't need anything else. Like, I'm here now. I've got the comb, and you're good to go.
It's just so simple, and the nice thing is it's transportable to all birth environments. 100%. So if you did need to go and take it in with you, you can in the car. Same with the TENS machine, aromatherapy to some extent, but all these tools, all these evidence-based tools, you then layer in one on top of the other, have a massive, and what we don't know is what happens when you bring them all together. We've researched them in isolation, but actually when you bring them all together and then stack them on a home birth, and then stack it on top of continuity of care, and stack it on top of hypnobirthing, and stack it on top of physiological birth education, what a massive winning combo.
Literally. And this is the thing, I think it's just so one-dimensional sometimes, isn't it? But actually you can bring all these modalities, like bring it all together along with the data and create like a fucking amazing package. And that leads me on to my next question, which is about actually getting an independent midwife. Like, what if you are one of these people who you really want to, whatever your situation, high risk, low risk, whatever it is, want to get an independent midwife? Like, what's that look like? What do they do? Where do they even start?
They hide under a little stone.
And you have to go searching for them.
You have to go on the beach and look for the right couple. So most independent midwives are on social media. You just kind of like put in your area or wherever. There are a lot of search directories and things like that as well. There's Find My Midwife. There's I Am UK, there's Zest Midwives. They've all got directories where you can go on and look for an independent midwife in your area. And then you just kind of find someone that you sort of feel like you connect with. So, for example, a lot of our clients are first-time parents, are sort of got more complex health circumstances or whatever, because that's probably who we naturally draw in, whereas other people might be drawn to a midwife that's more about like the spiritual side of things and the more rituals around birth, that kind of thing. So we all bring like a different skill set and a different sort of
well, you're all individuals, you're like unique, right?
To the table, and it's just finding someone that sort of fits with you.
That you're vibing with, like you got to
Yeah.
vibe with them.
Yeah.
I can remember like literally when I was pregnant with George, like I don't know what it was about you, and we hadn't like really spoken massively, but I was like, I need, like, if I'm having an independent midwife, I need Sarah. Do you remember?
Yeah.
And I was like, I need you to be my independent midwife. You're like,
And I was like, I live a little bit far away.
yeah, you're like a little bit like out, but I can like give you some suggestions. And I was like, no, I don't want anyone else. Literally, I was like, no, because isn't that strange? Like, I think you just like sort of pick up and you just know, don't you? Like, what like that kind of person is. And it's quite nice actually with social media, because I think you can sort of see, can't you? You can sort of like, it's definitely not the same as like meeting the person in person or having the conversation with them like on the telephone, but you can sort of get an idea, can't you, of like who they are and what they support and like what they like sort of specialize in, and yeah, that's amazing. And so what about like costs and stuff then? Because I mean, as a doula, when like it's the same, like you have to really have that connection with someone, you have to vibe, and it works both ways, I feel. So if I'm like sitting and, you know, I'm having a conversation with a family and they're like, yes, really, but I just don't feel like it's not right, I'm like, it just doesn't, you know, feel aligned for me. So it works both ways. But, and we're very, I know that a lot of doulas, I'm not saying we, because I'm saying like the whole, but I'm very flexible with packages, with options, with stuff like that. Like, does that work the same with like independent midwives? Is it flexible? Is there like, how does that work?
So a lot of families will need different things as well. So we can do everything from support you from the line going blue, right the way to like the first 6 weeks of baby being here, and everything in between.
Oh my God, it just, you know, it just makes it so like, oh my God, just being held for that, like all of that time. Oh yeah, sorry. It just makes me want to have another baby.
This everything I do makes me want to have another baby. It's a dangerous profession to be in.
literally
Very dangerous. Or some families feel like they just want, like we've got a family at the moment and she's got loads of support postnatally. She's got loads of family around her. She feels like the community team, she gets what she needs from them. So she just wants the antenatal support because she falls out of guidelines. She doesn't want to have all those challenges. She's already made an informed decision before she even melts.
Right.
So, and she just wants the birth and the antenatal care. So almost all the independent midwives will kind of create something bespoke to whatever your unique needs are, because ultimately that's what we're all about. So most independent midwives, assuming for like full care for the full continuum, usually it's sort of between £7,500 to £6,500, and that will include the indemnity insurance, travel. Most midwives, that will include a pool, your gas and air, like a one-stop shop. And we come and see you at home. All your care is at home on a day that suits you. If it doesn't suit you because actually you've got parents' evening now, we just flick it around. You know, it's all done around you and your family so that we slot into your life,
right,
apart, as opposed to you sort of fitting into our schedule.
Yes.
So that works really, really well. And that also reduces a lot of antenatal anxiety, a lot of antenatal stress.
Literally, it's this is the thing, isn't it? It's like almost putting a price on, like, can you really put a price on like how you want to feel, or, you know, how you want to experience that pregnancy for yourself, like, or what feels good for you. Like, I feel like it's like investing, isn't it, in yourself and your care and your pregnancy and your birth. And if that's something that is doable for you, then absolutely.
Yeah, it is a big investment, and we always appreciate and understand that. But you will only give birth to this baby once, but you will remember it forever.
Yes.
And it's a bit like any big event, like a big 40th birthday or a wedding or a
Isn't
christening.
it funny how literally we spend so much money, don't we, on like a wedding?
Yeah.
But then when it comes to birth, we're like, we can't even chuck like 13 quid at a book.
But that's
17 quid, sorry, at a book.
But it's because the birth is all about us. And traditionally, culturally, as women, we're not the best at focusing on us.
Oh, literally hit the nail on the head. That is it, isn't it? We just outsource our power. We're just constantly thinking about everyone else and everything else, and not actually about ourselves. But when you put it into that perspective, like, why wouldn't you have the same process, have the same planning, have the same, like, you know, celebratory kind of attitude when it comes to your birth experience as you would getting married or having one of those big birthday celebrations. That's amazing. And I want to finish off with one last question, which is, what is the most, like, what is the, like, the best thing or the most fascinating thing about supporting a home birth? For you,
For
like,
me,
for
like,
you personally, as you, like, what is the best, the best thing about that?
it's a transformation. So through all those surges, when everything is, she's in the real depths of labour,
Yeah.
I can always see the steps beyond what's happening right now to her holding that baby,
Wow.
and the anticipation of what is to come, and watching the transformation, whether it is watching her become a mother for the
Mm.
first time, whether it is watching a previous experience become extremely healed for maybe it's the second or third time or whatever when she meets this next baby, or whether it's just her finally doing something completely on her terms. She's had great births before, but actually, I'm going to do this exactly my way this time.
Right.
It's watching that transformation in her is, and that's not exclusive to home birth, don't get me wrong, but it is the most powerful thing to watch. And just
Mm.
to be privileged enough to watch her go through
Witness
that.
that.
It's beautiful watching a new baby enter the world. It's beautiful seeing this new person come, but to watch the transformation in her is the biggest, most
Wow.
amazing thing.
I just love that. What a way to finish. That's just so beautiful, and it is really just such a transformational thing. And we all deserve to invest in ourselves
Mm,
and in the process and in our preparation so that we can really lean into our birth experience.
mm.
Amazing. Thank you so much for
Thank you
coming
for
on
having
and
me.
talking to me about this. And yeah, it's been amazing.
Fabulous. Thank you very much for having me. It's been an absolute delight.
You're welcome.